Knock, knock. Hi, my name's Tommy. I'm going to be your nurse today. I'm just washing my hands. Could you please verify your name and date of birth? Verified on the patient's wristband. I'm just going to pull the curtain closed, close the door. I'm going to be doing a cardiorespiratory assessment on you today. Is that okay? Patient agrees. Do you have any concerns with safety before we get started? Okay. So first, I'm just going to assess your level of consciousness. Could you just tell me your name, date of birth, where you are, what time it is? Person is alert and oriented ×4. Skin color is pale and pink with warm touch. First, we'll just inspect the general shape of the thorax. So with this one, we can do our hand test. So we could say 2-to-1 ratio, which does not indicate any barrel chest. Next, I'll ask the client to just lay back for 1 minute, count the respiration rate. Seems to be about 19 respirations per minute. Not labored, not using accessory muscles, they're not tripoded, there's no cough present. And then next, I will ask the patient to take a deep breath in. And we can feel that thorax expand. And then next, we can do tactile fremitus with our hands on the back, medial to the shoulder blades. And ask the patient to say 99. If no vibrations are present, there's no tactile fremitus present. Next, we'll also take breath sounds on 8 places on the anterior and posterior thorax. So we'll start up here by the collarbone. Deep breath in, deep breath out. And then you move directly across to the left side. Deep breath in, deep breath out, deep breath in, out. And we're comparing symmetry left to right to make sure lung sounds are equal with no distress. We would do the same thing on the back. Deep breath in, deep breath out on all 8 left to right in the 8 places. And then we'll also take the breath sounds in 2 places in each axillary area bilaterally. Do the same thing. Ask the patient to take a deep breath in, deep breath out, deep breath in, deep breath out, deep breath in, deep breath out, deep breath in, deep breath out. No wheezing present. And then next, we're just going to move to the carotids. We're only going to do one at a time. You never want to do both. So it's between the trachea and your sternocleidomastoid muscle. We would say it's a 2+ normal on the right, 2+ normal on the left. And then next, we're just going to auscultate each carotid for Brutes. We will hold our stethoscope up to it, ask the client to hold exhale and hold breath. So make sure there's no Brutes present. Next, we're just going to palpate the anterior thorax for heaves and thrills, so vibrations. You can just put your hand on your chest. And this is also a good time to assess for capillary refill. It should be less than 2 seconds, which it is. No thrills or heaves present. And then we're going to auscultate the sounds of the heart. So first we start off with the aortic valve. That is at the second intercostal space, right sternal border. And then we move to the pulmonic valve, second intercostal space, the left sternal border. And then we're going to move to tricuspid, which is the 4th intercostal space, left sternal border, and then to the mitral valve, 5th intercostal space, midclavicular. S1 is also loudest here. No murmurs or anything noted. These are all normal heartbeat sounds. Of course, when we would be doing this, we would be doing this on skin for the best noise production, but for this purpose, that we'll keep the shirt on. Alrighty, that concludes my cardiorespiratory assessment. Do you have any questions? Are you comfortable? Alright, the call light is there on your table. as long as your personal items, glasses, and your phone. I'm just going to wash my hands, open the curtain. If you need us, call us, okay?